This is a 3-phase rehab program for 3 primary goals. First, we want to increase the range of motion to allow for full terminal extension. Following a 3rd-degree ACL sprain, the extension of the knee will be reduced to pain and swelling. Second, we want to maintain and improve the strength in the muscles surrounding the knee to help support the joint. We will be focusing here on the quadriceps. Finally, we want to maintain and improve proprioception. This is the body's ability to know when the body is in space. This is done with balancing exercises. It's very important that you do not allow yourself to go into a position that induces pain. This is your indicator of how far you can go into an exercise. Listen to your body. Knee extension. For this flexibility exercise, sit on a flat surface with your legs extended and toes pointing up. Place a rolled up towel or pillow under the ankle of the injured leg to elevate the knee off the surface. Now, relax your leg, allowing your knee to drop towards the table. This position should be held for 5 seconds. 1 set and 8 repetitions should be done 5 times a day. The goal of this exercise is to regain extension of the knee. Quadricep flexion. In the same sitting position, contract your quadricep muscle and hold this contraction for 8 seconds. 1 set of 8 repetitions should be done 2 times per day. The goal of this exercise is to maintain strength of the quadricep muscle and supporting muscles of the knee. 1 leg balance on foam. In a standing position with your knee at a comfortable angle, stand on your injured leg on a foam pad while holding onto a wall, chair, or table. Try to stay in a stable position with no rocking from side to side or forwards or backwards. In this demonstration, the athlete has your knee at a 30-degree of flexion. This position should be held for 5 seconds and should be done for 1 set of 5 repetitions 2 times per day. The goal of this exercise is to regain balance. Knee extension with band. Sit on a flat surface with your legs extended and toes pointing up. Put a towel, band, or belt around your foot, holding the ends in one hand. Gently pull the foot in towards the ball. Hold this position for 8 seconds. Do 1 set of this exercise with 8 repetitions 2 times per day. The goal of this exercise is to regain full terminal extension of the knee. 1 leg quarter squat. Start in a standing position with legs shoulder width apart. Lift the uninjured leg in front of you and bend injured leg into a quarter squat. This means you go down into 45 degrees of flexion. Make sure your knee is always pointing forward, not sagging or buckling to the inside. Do 3 sets of 8 repetitions 1 time per day on both legs. The goal of this exercise is to build strength in the muscles surrounding the knee joint. 2-foot balance on BOSU ball. Take a BOSU ball and put the flat side down. Stand on the ball with your feet shoulder width apart and balance with 2 feet for 10 seconds. Do 1 set of this exercise with 5 repetitions 1 time per day. The goal of this exercise is to gain proprioception in the knee joint. Hamstring stretch. In a standing position, take the uninjured leg and place it on an elevated surface such as a table, exercise ball, or stool. This leg should be fully extended with the toes pointing towards the ceiling. To gain a deeper stretch, you can lean your chest forward. Do not bend at the hip. Make sure to keep your back straight. Hold for 8 seconds. This should be done for 1 set of 5 repetitions 2 times a day with both legs. The goal of this exercise is to maintain full extension of the knee and to stretch the hamstrings. Wall squats with exercise ball. In a standing position with your feet shoulder width apart, take a band and have it sit just above the knee. Take an exercise ball and place it at the small of your back. Now, do a controlled squat, rolling down the wall, taking 4 seconds to go down and hold the squat for 2 seconds. Return to standing position. At the same time, push outwards against the band to ensure that both knees are facing forward and are not buckling inwards. Be sure to only go to 90 degrees of flexion. 3 sets of 8 repetitions should be done once a day. The goal of this exercise is to increase the strength of muscles surrounding the knee joint to increase stability. 1-foot balance on BOSU ball. For this exercise, take a BOSU ball and place it flat side down. Stand on the ball and balance on one leg. Hold this position for 5 seconds. Ensure that you practice this with both your injured and uninjured leg. Do this exercise once per day with one set of 8 repetitions. The goal of this exercise is to increase proprioception control of the knee joint.